So I think it really suggests also that this is a promising drug. So the initial data were presented, I think probably more than 2 years ago at ASCO. And again, as you pointed out, ZW25 is a bispecific antibody against two different epitopes of HER2. So essentially, it's trastuzumab on one arm and pertuzumab on the other. And it was specifically designed with the thought that it actually would have synergistic benefits above and beyond just throwing trastuzumab and pertuzumab together. The initial data that were presented, I think it was a relatively small group of patients with GE junction cancer. I think it was maybe 15, 20 patients, and it was very promising. And the data that were presented today or recently at GI ASCO really reinforced that. We see that as monotherapy, it has a response rate of about 40% in a treatment refractory population. So patients who previously received trastuzumab. So that's extremely encouraging. And when combined with chemotherapy, it also appears to be, to have additive activity. Based on that, in esophageal gastric cancer, there's currently an ongoing study that's adding it to kind of first-line chemotherapy with a fluoropyrimidine platinum doublet. There's also an arm that actually adds an immune checkpoint inhibitor as well. So it's kind of three different drugs. Separate from that, we also know that there are actually multiple other tumor types that actually are HER2 positive. So specifically, biliary tract cancers also actually have a high incidence of HER2 positivity of about 15 to 20%. So in biliary tract cancers, we also see that ZW25 is active.